Well, good evening and welcome to our special virtual meeting of April 21st, 2021. So welcome to our members of council, staff, our invited guests, and members of the public. I would like to call the meeting to order by resolution.
It's moved by Councillor Gardner, seconded by Councillor Fraser, that the special meeting of the Council of the United Counties of Stormont, Dundas, and Glengarry be hereby called to order.
Thank you. You heard the motion. All in favor of the motion? The motion is carried. I would ask the clerk to do a roll call, please.
Councillor Armstrong.
Councillor Armstrong, present.
Councillor Bivalds.
Present.
Councillor Fraser.
Present.
Councillor Gardner.
Present.
Councillor Laundrie.
Present.
Councillor McDonald.
Present.
Councillor McGillis.
Present.
Warden Prevost.
Present.
Councillor Smith.
Present.
Councillor Warden.
Present.
Councillor Wirt.
Present.
Councillor Williams.
Present.
Okay, thank you, Madam Clerk. Adoption of the agenda. I presume there's no additions to the agenda. We have a motion, please.
It's moved by Councillor Warden, seconded by Councillor Wirt, that Council approve the agenda as presented.
You heard the motion. All in favor? Motion's carried. Number 3, any disclosure of pecuniary interest or general nature thereof? Not seeing none, we'll move right into the agenda item, which is 4.1, COVID-19 pandemic response update. So at this time, I'd like to introduce our guests this evening. So we have our MP, Mr. Eric Duncan, our MPP, Jim McDonnell, and Dr. Paul from the Eastern Ontario Health Unit. So welcome, gentlemen. I will give the floor over to our MPP, Jim McDonnell, for a quick update in regards to the COVID-19 across the province. Mr. McDonnell, you have approximately 5 to 10 minutes to give us a quick update, and we'll open it up to questions thereafter. So the floor is yours.
Okay, thank you. And I guess everybody can hear me, and I want to thank you for the invitation to today's meeting to present some of the actions that our government has taken during this unprecedented worldwide pandemic. The world has suddenly been hit by the worst pandemic in over 100 years. Like everyone else, Canada and its provinces were unprepared, unable to access much of the essential supplies from domestic suppliers, and forced to rely on foreign sources as worldwide demand escalated and exceeded available supply. Early on, it was agreed that the vaccine procurement would be best handled by our federal government. Contracts have been put in place with exclusivity clauses, limiting any authority or jurisdiction from accessing the details. Now there's been some challenges with the deliveries, and in March alone, we received over 800,000 less vaccines than promised by the federal government in Ontario. In April, we have seen much the same, with Moderna and AstraZeneca vaccine deliveries being deferred and cut back. The commitment that would be a wash in doses did not happen. The unpredictable deliveries and last-minute announcements have made the scheduling of appointments challenging and results in delays of establishing new clinics while supplies are received. And our health unit temporarily has been caught in this issue with last-minute missed deliveries of the Moderna vaccines. The good news is these doses have been replaced by Pfizer supplies, and we are now in the top half per capita deliveries in the province. And they're being distributed quite efficiently by Dr. Paul and his team. And I've talked to Dr. Paul and believe that he has some important details about the rollout as well. I understand that there's concern over the pharmacy rollout, and we received the AstraZeneca vaccines at the end of March with an end of March expiry date. The program was hastily put together to run a pilot in 3 locations to use up these vaccines. The Kingston and surrounding areas was the closest pilot to our region, with numerous pharmacies participating, some big, some small. Earlier this month, the federal government secured AstraZeneca vaccines from the US, where the vaccine was not yet approved. The ministry added additional pharmacies across the province, with our health unit receiving 3, 1 in Winchester and 2 in Prescott and Russell. 2 weeks ago, they announced 3 additional sites, with 2 of them in Cornwall. And I want to thank Dr. Paul for his support in getting early access to these new vaccine sites. As of today, the Ontario government only has confirmation on deliveries from Pfizer until the end of April. with expectations of increased supply in May. Allocations for the more flexible Moderna, AstraZeneca, and Johnson & Johnson beyond what we have on hand are still unknown. Unfortunately, these 3 vaccines would be the best delivered by pharmacies. Approximately 700 more pharmacies are to be added to help with this rollout when additional vaccine supplies are received. The federal government's messaging has changed from deliveries by the end of April to deliveries by the end of the quarter, aka June. To date, the Ontario government has distributed its vaccine across the 34 public health units on a per capita basis. So as you've heard over the last few weeks or couple of weeks, the command table has been very critical of this practice and are recommending that we target areas with the highest per capita numbers, neighborhoods in Peel, Toronto, Hamilton, and Ottawa, to mention a few. The good news is we don't have any of these hotspot neighborhoods at this time. So it's as we move ahead, and they've been trying to respond to some of the more hotspots in the area, and Peel comes to mind. So we've been looking at a program and going forward in response to the command table's request. We will be targeting 25% of the future deliveries to these hotspots and distributing the remaining 75% on a per capita basis. And while this may have an impact on our program locally, it is the right thing to do. And I know there's been a lot of talk about some of the areas, in particular Peel, that they've had their challenges there. Of course, it has the highest per capita case rate. But it's interesting to note, even though we put a lot of attention, we've opened numerous pop-up sites, many clinics, it is still the 3rd lowest per capita receiver of doses. It's been a challenge to get people in some neighborhoods to accept the vaccine. So some of the questions I received are, why are some areas down at lower age groups? Quebec was below, as an example, down below the 70 before Ontario was. Certain regions of Ontario, like Peel, was lowered, and now I believe is down to 30 years old and older. And that's mainly because of the vaccine hesitancy, and we can't get certain people, many people, to volunteer to come in and actually book a vaccine. Now, the good news, these pop-up sites have been successful, and we are going out during the day to areas where they are. These residents are in large apartment buildings, in workplaces, and we've been able to vaccine fill, our appointment schedules. But it is a challenging program, and I look at our region where I know where originally, when the vaccines became available in Kingston, I was surprised by the number of people I knew to travel to Kingston to get their vaccines because they were available and you could book them. But in other areas of the provinces, they're not as eager to get them, and it is a challenge because we do need to roll out approximately in the neighborhood of 80% of the population to receive these vaccines before we receive what they call a herd immunity, and will take us out of this vaccine. Because as everybody knows, our hospitals are are certainly overwhelmed. We have patients from Toronto being transported to London and beyond. We have patients from Thunder Bay being transported to Manitoba. In our own area, we're transferring patients between the hospitals to look for facilities. And this is extremely worrisome because you may get sick with COVID and need a facility, but you also may be in a car accident, or you may be have a heart attack. And we need to keep these intensive care facilities available for our residents. And that's the reason for the latest lockdown that came up. We moved about, I think it was April 8th with a 4-week lockdown. And after new modeling came in last Thursday, it was very clear that we needed to get more serious, and we took the measures we did. And while not popular, these are an issue right across the province and right across the country. And I think, when you look at the stats and compare us to the other provinces, we've been very successful in we've had some of the lowest cases per capita in the country, lower than BC and lower than Alberta, lower than Quebec, but those numbers are still high. And the third wave is proving very, very difficult. We had tried to work with the Prime Minister last fall to close the airports because these variants, as Premier Ford said, they didn't walk into this country, they came in somebody from outside. And, they spread like wildfire. And now across the province are over 70% of the variants. So we know that they're much more contagious. They're much more likely to put younger people in the hospitals. I'd heard today we had a younger person, somebody in the low 50s, pass away and in Cornwall. So these numbers are no longer just affecting our oldest and more vulnerable people, residents. And we know that the vaccine works because I think it's Dr. Paulo, where we've been able to vaccine the majority of almost all the residents of the long-term care homes, the cases have just fallen off. In fact, the only outbreaks we have are with people that are working in these facilities that refuse to take the vaccines. And that's another troublesome issue we're dealing with, but so far that's the conditions we're faced with. So we need to get out. We early on agreed with the federal government that we would be looking after the businesses, and the federal government would look after the income, and we set up, and we all agreed, and the 10 provinces worked, I think the Premier Ford and the lead, to develop a sick day leave with the federal government. It's not what we like to see. We did work with them throughout the year. We tried to get them to improve them. We had some commitments that in the upcoming budget that just passed this week, that we would see some improvements to this plan. And unfortunately, with all the money being spent, there was $0 added to this plan. And it's interesting to note that of all the speeches I've heard that the Prime Minister give, I think I've only heard him mention once this sick leave grant or program that the federal government is running. And it's unfortunate because a lot of people don't know about it. It's not perfect. But when you look around, our competitors, our countries, no other province in the country has a sick leave plan. They all relied on the federal plan. We are the only province that guarantees employment. If you are sick, you can't be fired. We passed that law early last April, and we're proud of that. We took some of the first steps. But a better sick leave plan is required, and we're working on that. We have almost $700,000 in Ontario's taxpayers' dollars under the control of the federal government, and we hate to give that up. It's a lot of money. It's like double dipping in the taxpayers' pockets. But something has to be done, and it appears like we're not going to get cooperation at that level. So maybe all I have to say now, we do have some plans for businesses, and of course, municipalities have been the recipient of many grants over the last year, trying to make sure that they're whole. So maybe what I can do is answer them later as part of the questions.
Okay, thanks very much, Mr. McDonnell, for your comments this evening. I am going to open it up to questions at this point to members of County Council. I will ask members of County Council to please direct your question to one of the individuals that we have with us this evening. I would ask that you get right to the point and right to your question. If there is a rebuttal to that question, I will accept that. If not, then I will move on to another member of council. And if you have a second question, I'll come back to you at a later time. So I'll open it up now. I see a lot of hands going up. So the first one, I believe, was Councillor Armstrong. And then I'll ask for a showing of hands thereafter because I lost a few of you. But go ahead, Councillor Armstrong.
Thank you, Mr. Warden, and I'd like to thank our three guests for making yourselves available and making yourselves available on such short notice as well. This is probably long overdue, and I'm glad to have some questions answered. I won't have a big preamble, but I guess my first question, because it's the most recent, would be directed to MPP McDonnell. Concerning your comments in the standard freeholder on April the 16th, expressing your dismay at the Cornwall Mayor Clement I assume probably a little bit for the warden as well, for some of the critiques that were made and some of the concerns about, including Dr. Paul and the CEO of the Cornwall Hospital wanting our area there, the city declared a hotspot. Not too much to belay on that, but in your statement that you just made, Mr. McDonnell, you talked about the openings being done on pharmacies being done on a per capita basis and rolling out the vaccines when possible at a per capita basis. But I'm curious how you feel about the current model, which I know will be changing a bit. But as it sits now, there would be 24 pharmacies open for giving out vaccines through the Lanark, Leeds, and Grenville area, and there would be 6 for the Eastern Ontario Health Unit area. I'm not great at math, but that's 200,000 people in the EOHU to 175,000 people in the other group. It's not an us and them, but as you well know, you represent our riding, and we represent our conjoined municipalities. So, did you express concern at this inequity? I know nothing's perfect, and I'm not holding you to perfection, but the question that I get from a lot of people is, where's our voice in Ontario? And I know that that you're speaking and that you do represent us well, but we don't see a lot of that because we're not it's not as available, let's say, to the layperson. Does that seem fair and appropriate to you that we would have this sort of model, and or how would you prefer to see a different model? If it is per capita, can you explain to me the discrepancy there?
Well, let's be clear. First of all, the mass number of doses of the Pfizer that we're receiving is done through the health unit, and that's on a per capita basis. Okay, there is an unusual number in Leeds and Grenville and Frontenac County. Part of those, or a good number of those, were involved in the original Kingston trial. And they surround much of rural Kingston into Frontenac County. So yeah, they're up there and they're in the Leeds and Grenville Frontenac Health Unit. But all but about 5 or 6 of them were there before this latest rollout. So there are, I was not happy with the road, no question. It took 2 weeks of lobbying and working with those sites were chosen by the Ministry of Health without any intervention from the government, as is proper practice, I guess you'd say. I was disappointed they hadn't consulted with the medical officer of health, and that was my main concern and main argument, that how could you roll out these pharmacies without asking the person that's responsible for the vaccine program in the area. We did have some success with the second round of 3. Unfortunately, they have no abundance of vaccines to open up anymore. They want to open up more. Minister is wanting to do 700 in the next couple of weeks, but we have no additional vaccines being delivered before the end of the month, and no commitment in May of those 3 vaccines that would be most suited to these pharmacies. The trouble with the Pfizer, it's very difficult to transport. It's at very cold temperatures. It doesn't last as long as it's open out. So there are problems with that vaccine. And that's the one we've had a good success and a good supply of, other than back in, I think in February, where they're doing some retooling and our supplies were at the last minute cut. But since that time, they've been like clockwork. We understand we haven't got a commitment that next month they're going to increase it significantly, and true to their word, they've been fairly, they've been good so far at keeping their commitments. The others haven't been, and we're somewhat worried we may not receive any more of those for some time. And I know the Premier's been working on this. He's not able to talk to the companies themselves because of the contracts, but he's been working with other countries, and that's the only avenue that it's open to us. Anyway, we have working hard on it, but there's no use opening up pharmacies to have no vaccine supply. Good news is I've talked to the local pharmacies, and the ones that have it, they're only given more vaccines when they run out. And the Winchester one has been going through much more than the average, because as soon as they run low, they're kept centrally and they're shipped out as soon as they're needed. So they've gone through, I think, they've up to 600 doses delivered, and they just started, I think, on the weekend. So they've done a pretty good job, and they have some issues because unfortunately with the AstraZeneca, people are shopping around, they make appointments, they find a better appointment somewhere else, and they don't show up, or they find a Pfizer somewhere. So they're dealing with a lot of no-shows, and they never get a warning. They just find they have an appointment and nobody shows up. So they've been able to deal with that, but they're still, until this week when we lowered the age to 30 or 40, it was kind of tough to get rid of this AstraZeneca vaccine in many patients.
If I may just have a follow-up, I appreciate that was what I was looking for, was your opinion on it. I understand who is in control of it, but the people of SDSG would like to hear from their representative. Try to hear what your opinion is on it. I understand that you're only one man, and that is the situation. However, I would like to point out that, if there was the magic plane, I do understand that we'll blame the feds and they don't have the vaccine, but we have to operate in our cocoon, in that if somebody flew over and there was a magic plane that gave us, 65,000 vaccines right now, we wouldn't be in the position to dole them out. So I understand you can't just tap pharmacies, but I would hope that you would have pharmacies at the ready should something open. Things do change quickly throughout this whole time, and I'm not saying it's not there, but people are unaware. So when they see a number of 6 pharmacies, that gives them pause for concern, and they don't hear the information. So it's nice to hear that, but I would hope that they are prepared. If things do, let's say the feds do their job, I would hope that you're in the position to do your job.
Well, I visited some of the local pharmacies, and every pharmacy that participated in the flu vaccine is on the list for this program, but it's all based on supplies. And my biggest beef with the feds, and I mean, I understand they have a worldwide demand, and I appreciate what they've done, but just level with this. I'm sure on Friday, before Friday of a weekend, they knew the vaccines weren't coming in the next day. And I look at somebody like Dr. Paul trying to run a program where you're trying to, you'd like to look at the forecast of what's coming in and trust it. We had Manitoba have to call 25,000 people to reschedule vaccines because they didn't show up. I mean, you can imagine the workload, and we've had a few areas that have been overzealous with scheduling dates based on forecasts. And we'd just level with us, let us know what's coming in. And so what it results in is nobody wants to set up a schedule until you have them in the shop. And that's not very efficient, but that's what we've been drawn to because we've been caught too often. And I think that locally, we've done a great job. We haven't run out. He's had to call a few favors to get supplies for things, but going forward, we're very much aware that we have to wait till we have them delivered inside the province before we can, follow through. We're giving forecasts out based on what we know, but nothing's really for sure until they actually land in Toronto.
Well, there certainly are some issues because I would be able to I'd be able to make an appointment in Ottawa at any time almost that I would like. However, I can't make an appointment in Winchester or SDG. So there are some issues to be done. To say that it's working well might be an overstretch. Certainly people are getting them in the arms, but there's a propensity for Ottawa people in the Winchester area and people from outside of the EOHU, which when I spoke to Dr. Paul before and asked that, you indicated that it would be region by region. So somehow the technology is not keeping up with the promise. But thank you for the time, Mr. Warden, and thank you for the answers, Mr. McDonnell.
We're well prepared to increase. I think Dr. Paul, very quickly as tomorrow, if he had the vaccines, could up his clinics by 50% easily, just with the clinics he has. Right across the province, we've been canceling many of our clinics in Toronto for lack of vaccines. So we know that we've been delivering up to 150, but we could scale it up to 300,000 a day within days. As long as we could count on the vaccines and we have them in hand, those appointments are being made.
Well, you wouldn't run into that problem if you had them in SD and SG, I can guarantee you that. And the Winchester Pharmacy doesn't operate on Saturdays, just to be clear. And they can only do so many in a day. So even if you could do 10 times the vaccines for them, they wouldn't be able to get them in people's arms. But it's good for people to hear that they would be possible.
I think we'll move on to another question. And before I get to that point, I do have a comment and then a question if I can, because normally I don't have that opportunity. My comment is I phoned the Shoppers Drug Mart in Cornwall this morning, and the comment that I received is, please call back at a later date because we have no vaccines to make an appointment for. So they told me to go on the website. So I went on the website and I came up with the one under Fresco. When I punched in the Fresco one, it told me that the closest area that I can get vaccinated at this time would be Orleans. So I don't know what the comments are to the general public. I mean, there should be more comments, I guess, in regards that vaccines are not available. So please don't phone in or don't even bother going onto the website in regards that you can't even make that an appointment. And I guess the other part to that is the second part is the question is, why are we allowing people to come out of our Eastern Ontario Health Unit area to be vaccinated in our area when we can't even vaccinate the people that we have? I know, like Jim said a while ago, that many people are going to the Kingston area, but if we can't get vaccines to do 200,000 people, why are we allowing people from outside of our area to come in and be vaccinated, taken away from our residents here in SDG, Prescott, Russell, and Cornwall? I'm not sure who wants to answer that, if it's Dr. Paul or Jim, but that's an issue when I try to make an appointment, I can't, because probably the majority of those people ahead of me are from outside of our Eastern Ontario Health Unit area.
Well, I think it works both ways, but I think it all comes down to supply. If we had supply, the problems go away. And then that's the place.
No, I agree 100% with that. We certainly don't have the supply, but if we have certain amount of supply in our area, then it should be left to our people in our area only, not for outsiders to come in and take over. And then I can't make an appointment to go and get vaccinated because it's being, I know we're all from the same province, but I mean, if each health unit looks after their own people first, and if they have extras, then they can look after people from the outside of their health unit. But I think it's wrong where we're allowing people to come in when our own people in our own health unit can't get vaccinated. Dr. Paul, I don't know if you have a comment to that.
I think the impression that we're getting people from outside of our region is over amplified. I have the numbers, and they're not that many. And we have just as many going to Ottawa and getting vaccines. I
agree with that, but I'm talking about our area, and I'm not worried so much about Ottawa, but one coming into our area is too many.
But what I'm saying is that they are allowing inter-health unit shifting. And we were told that if there's an inequity at the end, we will get it made up to us. I specifically asked the task force about that, and I was told that you cannot refuse anybody from Ontario. So that's the direction I have. But I'm also told, and they're keeping tally of it, and I do get the tallies, and I know where our constituents were vaccinated, and I know which ones we vaccinated outside, and they're keeping a tally of that. So we will be compensated and get that back. So I don't have control over that. I was told that we must vaccinate whoever applies and whoever gets an appointment, unfortunately. So my initial approach, and I asked the general this when he at the task force, and we were told by no uncertain terms that we should be vaccinating across. And that's why the way the system is, it's the provincial system. They look at your postal code and they calculate what's closer to you. So that's why you're being offered Orleans.
No, I agree, and I think it's wrong only the fact that I'm 3 minutes away from a drugstore here in Cornwall.
I agree.
To Orleans because somebody from out of town is coming to take my spot here at our local Shoppers Drug Mart. Which
may I make a comment about the pharmacies to publicly say that I am extremely upset, and I'm saying this to the camera and people listening to me, at the way that the pharmacy the rollout of the vaccines has been done. It's unacceptable. I had to beg for 3 pharmacies in the beginning. And we had to even beg for the other 2 in Cornwall recently. And we never were given a choice of where the pharmacies would be. I know, and I'm very upset that Leeds Grenville has many more than we do. Ottawa has, 10 times as many as we do, much more by a per capita. So I'm extremely upset. I've raised this with the deputy minister, the ADM. I'm told, well, you're going to get your vaccine soon. The other thing I wanted to tell you is that I can kind of see why Leeds Grenville got more vaccine. We were, as you know, Ottawa got vaccine before we did. We got vaccine a month or 2 before Leeds Grenville and Renfrew did. And so I think they were trying to make it up with AstraZeneca at the end there. But the bottom line is that I'm extremely unhappy about the way that the pharmacies have been chosen. And I was very unhappy in the beginning with the discrepancy and the disproportionate number of vaccines our territory was receiving as compared to Ottawa. We had issues vaccinating our doctors in Alexandria, in our hospitals in Cornwall and in Winchester, whereas they were already vaccinated in Ottawa, as you know, the first phase. we've caught up with that. I'm very happy. And I can tell you that I've spoken to Jim. Jim knows I was very unhappy about the number of pharmacies. So he was as well. And he was instrumental in at least getting us the other 3. I'm not happy. I'm happy about that, but I'm not happy that we only have 6. I would have wanted some in Ingleside. I would have wanted some in Morrisburg. I would have wanted some all over, because we'd like to look at, a proportional and a location wise. You know that we have fixed clinics in, in 6 areas already, 3, 2 in SDG, but there were areas that I would have wanted there if they would have asked me, but they never asked me. And I've said, and I've told this to Cornwall Council, and I'm telling this to you as well. And so I'm quite as frustrated as you are.
Okay, just a quick question. I will move on very quickly, and just a quick answer if I can. Who's responsible for the pharmacy rollout? And if we can
The
get
government, it's the Ministry of Health, not me.
Okay, so if
I know it is the Ministry of Health, and we were, there was no political interference in it. If you look at it, they're spread around the, not based on party. Sometimes I thought it was, but not in our favor. But it's the way that they chose it. As Dr. Paul says, I think that vaccine-wise, we're very well served. If you look at the numbers, we're well ahead some of those areas, but they got more pharmacies. But you got to remember, these pharmacies have very limited supply, and they're going to run out what they have, and we have no replacement coming forward for possibly months. So they don't want to add any more. We're committed to getting some more, but they can't add any more until we get some more supply, because that wouldn't make any sense. You're hearing these people up. And
well, I
put
think
more signs up to say no supply, and that doesn't make any sense.
no, I agree with the not enough supply, but I think with between myself as warden and the mayors across the counties and Prescott Russell and the city of Cornwall, we can pressure the ministry to have our pharmacies in place and ready to go when these vaccines do come. And then we can get to our MP, Mr. Duncan, later to be forcing the federal government to get us more vaccines as soon as possible, but we'll get to that at a later point.
If I might say one thing, if we have a choice between the Pfizer vaccine and what's being given out at the pharmacies, the people have spoken very clearly what they prefer. So I don't think it's a real negative. We've had trouble getting people, when the age groups came close, we couldn't get people to go to the pharmacies because people didn't want the AstraZeneca.
Well, when I called the pharmacy this morning, I didn't specify in regards to what vaccine I wanted, and they told me to call back at a later date because they didn't have any of them. So if it is a federal issue, we'll speak to Mr. Duncan later this evening in respect to that issue, but I'll open it back up to questions. I know we had quite a few hands up, so I'll go to Councillor McDonald and Councillor McGillis. You're on mute, Jamie.
A good way to be.
Usually, yes.
Yeah, thank you, Mr. Warden. And if you'll indulge me, I'm going to jump off the vaccine bandwagon just for another question. I'm not sure if it's Dr. Paul or MPP McDonnell. On the weekend, we had a protest in Alexandria, of which there were in excess of 100 people not wearing masks. And I'm not commenting on the legitimacy of the protest, nor am I, or about the protest itself. My question is more for, we're not allowed to gather. So what do I tell my constituents who invite 6 people over to a campfire in their backyard? Do I just tell them they put up a protest sign and they're allowed to do it? Why are the rules different, and why are we not enforcing them?
Well, the rules aren't different. We certainly, we've seen some of the results. They go to, normally this vaccine or this virus has been very safe outside. But we've seen some cases around the province where it's been devastating. I mean, Bruce Ray Owen Sound, there was a bush party. Most of that's outside, I would have to imagine. Huge spread throughout the community. So it's, and we were faced with the dilemma: how do you close parks? A great example. Everybody. Our problem is when you drive by the parks, there's a huge group of people together talking to each other as their kids are on the playground. So if you're dispersed, it's not an issue. But when people get outside, they aren't apart. So this was a mobility problem, and we're faced. The modeling shows if we don't get serious in this, there'll be people die that don't need to die just because we can't get people to follow the rules and distance, like your experience in Alexandria. So the police they're out there, they're given the ability, if they see something like that, they can intervene. They don't want to, but public safety comes down to, and does it trump your freedom of rights? I guess, do I have any rights not to get sick? I guess that's the other question. And it's, you can see there's a big debate in the province. And we know that if we don't get serious, there'll be people die that don't need to die. It's as simple as that, because if you get in a car accident way home, there's no intensive care facilities left. You'll get to the door and you'll say, oh, Jamie McDonald, back of the line. And that's not something we want to see. And we're worried about that. And we're trying to take steps. I mean, people compare us to Florida, which I can't believe they've had 35 million people die down there. Or not 35,000 people died down there. In comparison to us, it's much worse. But it's the way to be. Well, it's spread down there because they don't have the measures we put in up here, or most of Canada. So it's not the money.
I guess though I'm not getting an answer.
The police give direction to break them up, and they have the ability to give out fines. So how they can do that best? I mean, they would like to break it up first, and if there's cooperation, that's probably the end of it. Once crowds get big, a couple of policemen are best to watch not to go in and start pushing people around. You know how that goes. So they're in a very tough position. I don't envy them, but they're doing what they can, and they'll try to disperse the crowds and send home the message that if you don't, maybe you may be getting sick and you may be okay, but your friend might not be, or your mother might not be, or that's really the message.
Okay, Councillor Martinell, before you have a rebuttal, Dr. Paul would like to comment on that issue. Go ahead, Dr. Paul.
Yes, first of all, I wasn't aware. I will be speaking to the OPP about that for future reference. We've had several similar ones in Cornwall. I worked with the police, and we actually processed judgments against the organizers. And so I would like to follow up with the OPP moving forward, because I think that those are illegal, although they're protesting. And you have to balance that. We're in the middle of a shutdown. And we need to take some action. We did in Cornwall, and I will be speaking to the commander of the SDG force tomorrow, Mark, to get some more information. We've had similar issues in Russell, and I'm working with the OPP there as well. It's a balance between, you don't want to go in with riot gear and break it up, because you have to, but we put in Cornwall, there were ways of being able to know who was there, and actions were taken afterwards. And so, because we didn't want to cause a scene, and we discussed that, and I do understand that there's going to be another one in Cornwall in May. So we're going to take the same tactic for that, because it needs to be addressed. Because I agree with you, it's not a good optic to have hundreds of people where you can't take your kid to the park. So I agree with you, Jamie, and I was not aware. Thank you for making me aware. I'm going to follow up tomorrow with the inspector.
Okay, thank you. Any rebuttal to that, Mr. Martinell, or is that good?
That's good. Yeah.
Okay, thank you. I'll go to Councillor McGillis, and then Councillor Gardner, and then Councillor Smith.
My question was similar to what Councillor McDonald's question was, because of the outdoor activities. There's a lot of people that don't know what's legal and what's not legal, and I get calls all the time, and I always say I refer them to the East Ontario Health Unit and talk to Dr. Paul. But I think we have to be a little bit more vigilant in educating the people in terms of what they can do and what they can't do in terms of outdoor activities. I just have a suggestion to Dr. Paul. I'd like to propose that they consider the Lancha Center in Ingleside as a location for a vaccination clinic. Accessibility of this facility would be ideal in providing another location serving residents to the west of the city as well. Another space that I want to just, maybe you can drop down to, that we have available for you, is our community center in Long Sault. I think it's important that you know about these other facilities that may help you.
Yeah.
Because like I said about the pharmacies that can't oblige requesting.
The pharmacies, thank you very much. May I respond, Mr.
Sure.
Warden? Yes,
Sure.
the pharmacies, okay, I'd like to have them all over. You know, their capacity is limited. The average is 25 per day. I do 2,000 to 3,000 per day. You know, you can't compare. But if it's all over the place and we can do some pop-ups in Ingleside or in Long Sault, we will be doing a clinic in Morrisburg, for example. And in the Morrisburg area, I was speaking with Mayor Byvelds the other day. So yes, I would welcome that. But I believe, again, it doesn't take away the need from the pharmacies, though. We're there because we want to vaccinate a lot of people at once. But moving forward, there should be more. And thank you for that. And we have an individual now that's going around and looking for sites. So that's going to be certainly one of the ones we're going to look at if we haven't looked at it already.
Okay. The question I have for you, Dr. Paul, I was talking to my colleagues earlier prior to the meeting. And the question I have is, are there any plans to set up any vaccination clinics and locations with many essential employees, such as Lactalis, which has over 400 employees there?
That's what yes, we are looking at all kinds of, when it's their turn, we're looking at ways we can batch do a lot of them at once. So yes, they're not there yet in terms of the sequencing, but we do have 2 ways of doing it. Either they can do it themselves, we can provide the vaccine, or what we can do is what we do similarly with our long-term care and our other congregate settings. We can send a strike team in and do it on the spot. I would prefer it that way. It's quicker, it's easier, we get it done. So yes,
Right.
we are looking at those. Thank you.
Thank you. Thanks, Mr. Ward.
Right now, the only thing we're also looking for, and if you know of any seniors apartments that we've missed, because we're now doing those, we're going to them. We've got a list from SDG, but I just want to make sure we don't miss any.
I just want to thank you too as well for recognizing all the municipal leaders and staff for being out there trying to advocate for you to get the things that you need to get done. So we're here for you. Just have to ask.
I appreciate it. I want to take this opportunity to thank all of our SDNG county municipalities that are working with us. They bent over backwards. We're doing this together. We can't do it without you. We have, just to give you context, when we have a clinic in Winchester, we had a clinic in Alexandria today. We have 15 vaccinators, and for each vaccinator, we need about another 2 people each. So we need 40, 50 people at each clinic. And we're running 3 or 4 clinics at once. So you could see the number of people that we need. So the OPP, the bylaw, all the people are helping us because we need crowd control, we need screening. And it's not the same as just a regular flu clinic because we have to have 6-foot distancing. And that's why we're using your arenas. And I appreciate that from all of you. We're using the Winchester Arena, Alexandria Arena, we're using Benson Center, and we'll be using likely the Morrisburg Arena or other similar big facilities. We need big facilities to be able to do a lot of people at once because we need that spacing for the tables and the spacing for people to wait afterwards. Thank you.
Dr. Paul, just to go on further with that, is there any thoughts in regards to high schools? They're very accessible, they're large, and they're empty.
The problem is that the gyms are too small for us.
Yeah.
They're too small because some of them, we're looking at the one in Seaway, some of them, because we need to get, in order to get a large amount of people, I need to put 15, 20 vaccinators in there. And so those tables have to be 6 feet apart. And then the people who are being vaccinated have to be seated 6 feet apart. So ordinarily we did all our clinics in those areas. So yes, we are looking at those as well. Ingleside in Morrisburg, it's one of the things that we're looking at. Looking at Seaway High School, I think it is, but they're too small, the gyms, for a large number of people. If we have a lower number of people, we can do it, but we'd like to be able to do as many as we can one shot.
Well, I think you have the gyms to do the vaccination, and then probably cafeterias where people can sit and wait before they leave. But
again, it depends how close they are, and yeah. So we're looking at all those as well. Yes, we haven't ruled those out.
Okay, thank you. We will move to the next question. I'll ask everyone just please to get to your questions because it is 7:20 already. So Councillor Gardner, if you would please.
Thanks, Warden. Warden Prevost. Just 2 quick questions. First, you've mentioned how serious and deadly this, as everyone knows, COVID is. Has there been a push to get some of the AstraZeneca vaccines that the other people don't want? Because I, for one, would take that vaccine in a heartbeat. I don't have a problem. And I know many of my friends around the 50-year-old age mark would take it. We'd much rather get the vaccine and take the risk than get COVID. So just a comment and possibly a thing. And the other thing for your consideration is now that the OPP have the powers to look at the borders. Last summer, we had a horrible situation on our waterfront areas in South Dundas, South Stormont, South Glengarry probably. And if their numbers continue to be high in Quebec and our numbers and the vaccines, which you have suggested are slowly rolling out, I'm just wondering, MPP McDonnell, what consideration you're going to do to make sure that our residents are protected from out-of-province visitors this summer when everyone's stuck at home.
Well, we're hoping that this is, we have I would like to say, and maybe Dr. Paul would maybe a little more information on this, but I'm hoping that we have most people vaccinated by June that want to get it. And that's, we're hearing big numbers coming in at least the end of May, and during May and in June. And there's a confidence that we'll have, by the summer, you won't have the under 20-year-olds done, but you'll have most of the adults that want it done by the end of June. So that should alleviate the problem. I know that we had some problems early on, and we worked with the police last year, and we let certainly know the other province people know that the parks are closed, the ones that were closed. That was a help. And then we also had the OPP working, and they were very good to be around. And you have to put a limit on who gets in. And once that was done, I think it worked fairly well. We are working at the borders today just because of the health issues. But if our goal is to get this problem behind us as quick as we can. And we'll take any vaccine, or to say, I know our premier is talking to different countries. There are some that don't like some of these vaccines or have stops to them. But right now we don't have access to them. But we do have a pretty good idea of where Pfizer is going, and Johnson & Johnson is a possibility in the near future every year. So that's another source, and I don't believe that's approved in the States yet. So there's some benefit there.
Just a quick rebuttal. When the Parks Commission closed their properties, those folks had nowhere to go. So if you had spent time on the Morrisburg waterfront, you'd see that we were absolutely inundated with folks. So just maybe keep that as a consideration.
Yeah, I went down one day or a couple of days to see Morrisburg, and I was quite surprised that along parks up to Morrisburg, we had a problem one weekend, and we worked with the police, and we had people at the gate only letting so many people in, and it worked out fairly well. I drove through those, and Morrisburg was an eye opener. I will say it's something that needs to be done there. So.
Mr. Warden, if I could just on that subject, albeit a provincial jurisdiction, we've had some families, to Councillor Gardner's point, reach out to us already with that concern, and we'll follow up with Jim as well. But I think a message to the St. Lawrence Parks Commission this year, making sure they don't close anything. The irony of closing things down for public safety, absolutely, I think backfired last year, and Jim saw that. So I think a message needs to be given now to make sure they have the staffing resources and the dollars to make sure they can manage every single site they possibly can. Because I said back in November, we had COVID fatigue. We're in a phase of COVID anger right now. And when the weather's better and people are pent up at home, and even adults have it, there needs to be a full plan for it. So I say the same thing at a municipal level. All of our trails, walking paths, all of that stuff needs to be full throttled open. That is the safest way we can get people out for mental health, physical health, and all of those things for sure. So
yeah, and folks, visitors arrive in May, not June, so the timelines don't really mesh.
Our borders are going to be blocked until at least May 20th. So.
Okay, thank you. I will move on to the next question. We have Councillor Smith, then Councillor Landry, Councillor Fraser, then Councillor back to Councillor Armstrong. So Councillor Smith.
Thank you. Through you, Warden Prevost. I guess I got a question and a comment, and I'm going to start off with the most important one first. I'm getting a lot of calls on this, and I'm not the right person that should be receiving these calls, but our residents are having trouble getting through to all the other offices. And it seems like it's just the councillors that are answering their phones. So this is the question I'm getting. in the long-term care homes in Woodland Villa in particular, and I don't know if this is in all the homes, but all the residents got their shots and they got their second shots, which is great. The frontline workers all got their initial shot. They were just told yesterday and today, from what I understand, as they were asking when they were going to get their second shot, that they didn't know because it was up to them individually now to book their own appointment. Now, I know anybody who's already got their first shot, myself included, has already got a date, an appointment date for their second vaccine or their second appointment. However, the frontline workers in the long-term care homes were with the understanding when they got that shot that they would be coming into the home at a later date and giving all the frontline workers their second shot. Now their arms are up in the air, wondering like, okay, so how do we get how do we make appointments for that? We have to jump back in line when all the time they assume that they would be coming to the home, which makes sense. And we just talked about it just minutes ago about coming into these places where there are lots of employees. Now, Woodland Villa, we're talking about 115, which is enough for the health unit to go in and vaccinate these people. What can you tell me about that and something I can relate to those questions and phone calls I'm getting?
I can tell you that.
Go ahead, Dr. Paul.
I can tell you that they're not put at the end of the line. We have special form curated lists that they can get vaccinated. They're not getting vaccinated until 4 months, as you know. There's a difference between them. We've had, the issue is that when we went in, we thought that we would do the first dose for everybody and then do the second dose for everybody, but things change because of supply. So at this point, we're trying to identify homes that have a lot of people. If there's a lot of them, we will go in. If there's a few, I can't, because we're actually doing other homes at the same time. So it's a matter of balancing it out, but they do have priority in our clinics. We're not going to forget them. And that's unfortunately what happened, because the ideal situation was for us to go in first shot and then go in and give them a second shot as well. But when we went in the second time, we were not allowed to give a second shot to the staff, only to the residents because of the shortage of vaccine. So that's what we're stuck with, Deputy Mayor Smith, unfortunately. And we're trying to pick up those pieces, but we're not going to forget them. I guarantee you that.
So what can I tell them to make them feel better?
Tell them that we're trying our best to either go back and vaccinate them or ensure that they have their follow-up appointment where it's reasonably close for them. But they will be prioritized. That we do have a second dose for them. We're not going to forget them.
What's frustrating them is they don't have a date. Like I have a date. I've had my first shot and I go back July 19th for my second shot.
You know why? Because they did not go through the system, the provincial system, which automatically spits out a second dose. We did it manually before all the systems came out because we gave the first shot back in January, February when we were going around. That's why. So they should start booking if their age requirement allows them to. They should start booking their second shot today. Yeah, and if not, call the health unit or the Woodland can call us, give us a list, and we can see what we can do. Like I said, we're sending our EMS right now to the other homes, group homes, lodging homes, and those senior apartments as well. And we've gone back to a few homes when they've had a lot of staff, and we've done them all. So when it was the second dose, we don't want to leave them behind. And it's unfortunate because the plan initially was we're going to go do the first dose for everybody, second dose for everybody, and done. And because of vaccine supply, we were asked not to give the second dose to staff, unfortunately.
So, and as far as the shortage, I guess I'm going to make a quick comment. I guess I really appreciate that. I was going to say hundreds, but I'm sure it's thousands of snowbirds that left the country and have been vaccinated already by another country. So there's some vaccines that should be made available to us. So we should be running out less. You know what I'm saying? Like it's this data. We should have the extra vaccines. But I'm just going to leave it at that. But I did want to make one more comment on something that Councillor McDonald had spoke about, and that is the rules of the lockdown. They're confusing and inconsistent. And for an example, you can go into Walmart, but you can only buy groceries. And everybody's happy with that. You can't go and buy barbecues and lawn furniture.
Yes, you can.
However, you can go into Backstrom's grocery store, and the first thing you can buy when you walk in is barbecues and lawn furniture. We're missing something here. It's inconsistent.
Well, first of all, at least they, after a year of us asking, they limited the Walmarts and the big box stores to groceries and pharmaceuticals. That at least. So that's another.
We're settling for them. They're telling us what they're going to do. Is what you're telling me.
Oh, no, the government. There was a lot of complaints last year about us allowing big box stores that had food to serve everything.
Yeah,
So
yeah.
we put restrictions in as the people wanted, but there is no restrictions on grocery stores if that's their main business. And of course, you walk into.
You know, I could be picky and go and order them not to sell that stuff, but do I want to do that? I mean, I can go into the store and like I had done with certain the big box stores. I actually had them. I put an order in where in the grocery section where everybody congregated that they had to have somebody counting people in that section, not in the whole store. You know, so I can do those things, but I get your point. I get your point.
Just making the point that it's confusing and it's inconsistent, and that's what's the mental health issue is what's settling in because of things like this.
But let me tell you something. I had a 51-year-old that died, and I have 2 people born in 1993 and in 1995 in the ICU right now. They're 35 and 40 years old. So this is real stuff. And our ICUs are overwhelmed across the province. And so we need to at least have something done for the short term. The good news is that we're looking at a flattening of the curve already. So that's the good news, but it's a short-term pain for longer-term gain. We're coming out of this having vaccinated in our area. Right now, we're close to 50,000 doses delivered just by the health unit in our area. By the end of the first week of May, we'll be close to 75, 80,000. We have a total of about 170,000 eligible people in our population. So in a couple of weeks, we'll have vaccinated almost 50% of them. So that's the good news. So I just want people to be more patient. We're getting a lot of calls, Deputy Mayor, about all these discrepancies as well. But I'm telling people, we're right at the end now, a couple more weeks, and we'll get out of this.
Thank you very much. And I appreciate the work that you're doing.
No problem.
Okay, thank you. I'm just going to make a comment, and it's only a comment. You don't even have to reply to it. It's just a comment. I go to Walmart every couple of times a week just to see what's going on. I'm not there to buy anything. I just want to see what's the activities that are taking place in the store. There's nobody at the doors. There is nobody washing carts. There's nobody to show it at the doors to see how many people are in the store. I go to the grocery store. I can't get in unless somebody comes out of the grocery store and the carts are washed or cleaned before I go in. But Walmart is totally different. Why they get away with that, I don't know. But it seems, and it's been since day one, since the lockdown's been happening.
We have after them. I will follow up. That's all I'm going to tell you.
Yeah, no, I don't need an answer. Thank you. As long as you follow up with that, I appreciate it. I'll go to Councillor Landry, please.
I'm mute.
You're on mute, Dale. Or for Francois, sorry.
Can you hear me?
Now we can.
Okay, so bear with me if my internet doesn't hold up. So since I have Mr. Duncan and McDonnell, just hear me out. So before I get to my question towards Dr. Paul or to Deputy Mayor Smith, I do have one of in my circle that has been vaccinated, not through the provincial program, so she does not have a date. Are you saying, so she was told that she was going to be contacted by the 4th month, but who knows, she might get to the 5th month and still be, should she be, I didn't get clearly, should she be contacting to book a second appointment, or is she still supposed to wait as she was told? You're on mute, Dr. Paul.
Where did she get the vaccine?
What does she work at? That's what I want
to. Well, she got it through because she's with her mother being in a home. She's
we have a list of those. We have a list of those, and we will call them back. If we don't call them back by the 4 months, obviously call us. But we keep a list of those because, like I said, we did it outside of the system that does it automatically.
Okay, so that's good. My question is, as far as the elderly people, that there's a short percentage that's left of them. I believe that they're still the most vulnerable. Is there a way, most of them are probably not in a home, they're still living in their own private homes, and they would depend on their family doctor, I think, is where they would see it. Is there potential of having a mobile, something to get them finalized and out? So that's first question. And just quickly, my second one is, I work in the Prescott Russell area, but they have Castleman as a depot. I think you do it twice a week, roughly. You get the vaccinations done there. I seen they had one in Russell or in the Embrun area. As the group is getting younger, is there potential of not having, because to displace the people from Castleman. Castleman is set up, I presume, all the time, ready to go. Now, to set up other areas in arenas takes time. Is there potential we can get around a younger group versus the elderly, that we stick to one less places, more vaccination in that area?
Well, what we're trying to do is, I just want to say that at this point we have 6 fixed sites in Winchester, Winchester, Alexandria, Cornwall. In Prescott Russell, it's in Rockland, Castleman, and Hawkesbury. Those are our 6 fixed. But we do have right now, what we're doing is we have distributed vaccine to 8 primary care family doctors all over, including Hawkesbury, including Alfred Latagenet, who are going to do their own clinic as well. And we have 15 more clinics all around who are getting Morrisburg, Hawkesbury, East Hawkesbury, all they're getting. And so we're also doing pop-up clinics in Embrun, and more in Embrun, and more after Plantagenet. So yes, we will be doing, we have facility, but we're distributing it in a way that it will be available to a lot of people. And by the time we start opening it up to younger individuals, it'll be available in multiple places. So pending our vaccine supply, this is what we got to do. Because don't forget, we're also vaccinating just us, a couple of thousand a day on a daily basis. So based on the vaccine supply, we're doing that. But and yes, we do have teams that can go to home individuals who are homebound. There are about 75,000 in Ontario that are homebound individuals. We have the list, and we actually go to their home and vaccinate them. We're also going with our mobile teams to I talked about it, we call it non-formal elderly homes, where there's a lot of seniors living in apartments. We do the whole apartment. So we do that at the same time that we're doing our mass immunization clinics. So yeah, at this rate, we should have, if we have enough vaccine, which I think we will, we'll have vaccinated all the people who want it in our area by the end of May, early June, first dose.
Thank you.
So maybe just add something so Dr. Paul, do you want them to register with the health unit if they're an elderly person that needs a home visit?
We're trying to get, we have the lists now, because the SDG and Prescott Russell have lists of where these apartments are. But if we haven't gotten them, and if the municipalities hear about it, just call us, particularly if there's somebody homebound. Today, I had a meeting with the Ontario Home Care Association, and we are getting a list now of people that the LHIN doesn't have. There are people that get home care outside of the LHIN. And so I have the LHIN ones, but I don't have the other ones. So if anybody has anybody that can't get a vaccine, can't move to get a vaccine, we will send an EMS at home to get it, to give them a vaccine. We did about 40 this weekend, 40 house calls this weekend.
Okay, thank you. I'll go to Councillor Fraser, then Councillor Armstrong, and then Councillor McGillis.
Thank you, Mr. Warden. And thanks to all attending. Get your pens ready. I've been sitting patiently. First is a comment to Dr. Paul and to, I guess, the MPP McDonnell. The actions were brought up by Councillor McDonald. Those things and the reaction from the OPP or from the health unit or from whatever bylaw officer is involved, they need to be announced and recognized. People don't believe these things are happening. If we don't see it, it doesn't happen, and it's hard for us to, as councillors, to express to our constituents that yes, the scofflaws, those that congregate and make a point and protest, and they're not being treated in the proper fashion, if it's not recognized and apparent that that that's taking place, then it's never happened, because I can't convince someone of something that can't be seen. That's just a comment. And yes, Dr. Paul, I want to express appreciation for the mass vaccination clinic in Winchester. I'm sure that the others have run smoothly as well. Well appreciated, and the relief expressed. It was during this pandemic. It was nice to be in a spot. I worked there for 3 or 4 hours, directing people and receiving good comments. So kudos to all the volunteers and to your group for ensuring that that took place. But one of the things that cropped up, and this is for MPP McDonnell, the Ministry of Health needs to have a secure internet service. The Ministry of Health wasn't allowing the EOHU staff to use the internet service provided at the Winchester Arena. It wasn't secure enough. They were relying on using data to convert to their internet service, so they had secure service, which we're trying to process 1,000 people. In 9 minutes that they had to sit to upload the information from the computers to the ministry to recognize that these people were being vaccinated. And it speaks, again, I know it's not pandemic related, but it speaks to the need to increase the internet service in Eastern Ontario. When the ministry recognizes that we can't vaccinate people in a quick fashion because of poor internet service. Number 3, if to MPP McDonnell, the metric that you spoke about at the outset of regionalism and hotspots, getting the vaccine distributed to those areas that are hotspots, well, that in essence is, in my mind, regionalism. And if we're going to use regionalism to determine how things are going to be used, why, if we're not recognized as a hotspot that needs to have the vaccine distributed, but Leeds, Grenville, Lanark, Frontenac, or other areas are recognized as areas that are in dire need of the vaccine, why are we treated in the same fashion during the lockdown? If it's not absolutely necessary that we receive the vaccines as it is necessary in other spots, why are our hairdressers, our small businesses, our restaurants, our hardware stores treated in such a fashion as if we are in a hotspot? If we need to be treated as if we're in a hotspot, we need to be getting the vaccines in the same fashion as those that desperately need it. Number 4 is a question, and for MPP McDonnell. When I look at the regs, because of the lockdown, if we're in lockdown shutdown, 43I talks about residential construction being permitted, and 43.1 talks about landscaping being permitted. The question is, what do people do? Do they follow the regs, or do they follow the whims and the opinion of health unit staff, OPP? And the anecdotal story is related to me by a fellow councillor. There's some landscaping going on, which is allowed in 43.1. And 3 squad cars appeared at the residence and told them to stop work, or they'll be coming out with fines if they hear about it again. And it's in the regs. So what does someone do? If we try to follow the rules, we read the rules, they were doing the right thing and they're told to stop. It's very hard to do something when you're presented with the rules and you try to follow them, and we're at a loss. And the last one, the warden speaks of Walmart, others speak of Walmart, and I'm sure someone else is going to take up the conversation after me. But how can we talk about Walmart being open, Walmart processing so many people, when we have hairdressers in our small communities that can't process one person? It just doesn't make sense. It doesn't make sense to me at all. I have a hard time defending those things because I can't come up with a good argument. And we, as councillors, we're the ones that are feet in the ground. We're the ones posing questions, and it makes it very difficult when we can't make sense of it, or at least I can't. And thanks again for all your time.
Well said, Councillor Fraser. Mr. McDonnell.
Well, there's quite a few questions there. I'll start them, and I'll go at the hairdressers and barbers. I mean, this virus spreads very much indoors, much more than our previous experience with the original virus, and it spreads outdoors. And I give the example of Bruce Ray, Owen Sound. A bunch of high school kids organized a bush party. It spread through the whole community. They went from 0 to hundreds in a week because it spreads outside too. It's close contact. And if you're inside, it's just that much worse. So if you're in Walmart and you can just like, I hate to use Walmart because if you're using a grocery store, if you walk into any of your grocery stores, it's the same thing. Just stay 10 feet away from the person around you, wear a mask, and it shows that you don't get the virus. So that's why keeping the numbers down. Grocery stores are limited to 50%. The bigger retail stores that are open are down to 25%. And it's to be very much police, because if you spread people out, they don't catch. And that's what we're looking at. But when you're looking at these personal services, if you get 10 feet away, you're not doing much good to them. So that's the problem. And they can't put the plexiglass up. They can't do a lot of those things because it's a hands-on type of thing. So the science is telling us. I mean, we didn't take this lightly. And we have put programs in place, small business programs to replace income. We've done replacement to offset the property taxes, the electricity cost during these times. There could be more done when we get out of this and we start to look at the survey the damage, you might say. But we're hopefully, as Dr. Paul said, just 3-4 months away from this. And certainly once everybody gets their first dose, we can start to relax it. And that really is our goal. It's dependent on the supplies, but I heard somebody say something today, and they give the example of an outside sport. We closed down the ski hills in Ontario this winter, and people were furious. Okay, they didn't in BC, and I go back to some of the data here. So Whistler Blackcomb Ski Resort stayed open. They were only closed by the BC government last month after we realized that the highly infectious variant traced back to Brazil was spreading, and now more than 877 confirmed cases of this variant is in BC, and it's the world's largest sequence outbreak. And it's because outside functions weren't curtailed and people get together. Same as at parks. Maybe we reacted to parks and people go up, but we go by and we see people together, and we just know that the result of that is one person has it, they take it home, the entire family has it, and it just goes from there. And that's why the schools are closed down, because it's getting into the families, and then that's the source in. We just need to get vaccines and people going.
Just before you go on to your next question, I'll just comment in regards to Councillor Fraser's respect of salons and barbershops. The stats are showing, and Dr. Paul has said it many times, that the stats are showing that the variances or the virus is coming from gatherings. I don't see one person being in a barbershop or a salon being a gathering. I think it's just, even before the lockdown, when I made an appointment for my barbershop, I had to make it a scheduled appointment. He brought me in about a minute or two before. I walk in, he locks the door. We're the only two in the barbershop. After I'm done, he cleans everything up. I leave. Then he brings the next one in. There was nobody else in the building but the two of us. I don't see that being a major issue. I think it's wrong in rural Ontario. I think it needs to be changed. And I think between the ministries,
a company that had a team meeting. One person walked in with the vaccine, the virus. Everybody gets it, and they weren't sitting in people's laps. That's local. You should have heard.
You're going to get cases from all over the place, but the majority of the cases are coming from gatherings. But we should not be hurting our small businesses where one person can go into a hardware store, one person can go into a clothing store, one person can go to a barber shop. I can go to an outside patio to have dinner with my 3 children, but that's all been taken away because of Toronto, Peel, and in different areas. It's all comes down to gatherings, but we're suffering all our small business in our communities. And Jim, you know yourself, we have small communities in the Williamstown area, with small restaurants and little local bars. These people are hurting. We can deny it or not, but they are suffering and they're hurting. And if we lose these small businesses in our local communities, our communities are done. And there might be financing out there to support them or help them, but it's not enough to keep them afloat, to carry on after the lockdown is taken away. We need to start.
You saw when the first lockdown came in and we put the restrictions, and you saw the numbers take off. You saw our hospitals are full. I've heard the presentation from Mr. Spatty. It's not pretty. And a lot of these, there's been a few big gatherings.
No, it's not pretty because it's not only COVID-19 cases in our hospitals. We're bringing people in from other areas outside of our jurisdiction to fill our hospitals. So,
Frank, I'm not an expert, but I listen to what the medical experts are telling us. That's all we
No, and I
can.
agree, and I appreciate that, and I respect the hospitals, and I respect that the nurses and doctors are overloaded, but I have a hard time, and like Councillor Fraser said, and I will disagree 100% that there's no reason why one person can't go into a barber shop. There's no reason why one person can't go to a hardware store, and there's no reason why one person can't go into a clothing store. But I can go with 250 people into a grocery store, and don't tell me today that somebody's at Walmart telling that they're only allowed 25% of the people in the store because there's nobody at the doors. And there's nobody at the door in regards to grocery stores, knowing that there's 50% of the people in the grocery store. But that's okay. But I can't go get a haircut with one person in a store, or go to have lunch or dinner with my family at an outside patio where there's not another patio for 3 kilometers down the road. It doesn't make any sense. Golf courses are closed. Where's the most open space in the world is a golf course, and I can't take my 3 daughters and go golfing.
You know what? You know what, Frank, is that ski hall.
I'm sorry?
Thousands of people died. You know, BC became the epicenter for that.
We're not BC. We're Ontario. We're rural Ontario. Rural.
Yeah.
We're not downtown Toronto. We're not downtown Peel. We're not downtown Ottawa. We are rural Ontario.
Our numbers were.
Well, Councillor Fraser made a comment a while ago, is we're being suffered or penalized because we are being put in the same numbers of other communities across this province. And we shouldn't be. We should be looking at it a little differently in rural Ontario.
I'll tell you one quick story before I go off.
I'm sorry?
At Christmas time, there was a family, a local family, talked about getting together Christmas, 5 or 6 in the family. They thought they'd get together, no problem. The mother and father ended up in the hospital. The father, 61 years old, died. COVID.
Jim, I'm not talking about
All
families
gathering, family only. That's what's happening.
I realize that, but I'm not. We have a lockdown in regards to we're not supposed to be meeting our families, and I don't go to my brothers and sisters. I'm talking about my own children. If I can't go to a restaurant and sit in an outdoor patio 6 or 8 feet from somebody else with my 3 daughters, that's a problem. I don't get that. If I'm meeting my brothers and sisters at a restaurant, then yes, that is a problem. But again, golf courses are, you know, it's the most openest space in the province of Ontario or in the country, and I can't go golfing. Like, it just does not make sense in rural Ontario. And that's where to me is yourself as the MPP has got to go back to the province and saying, look, we are different in our area than we are in Toronto and Peel. And the Premier's got to start looking at that, and waiting till like May 20th is when we may consider reopening Ontario. I think that is totally wrong for rural Ontario, but I can go on all day and I won't continue because I do have other people that want to speak. So
our rural hospitals are as full or fuller in the big cities.
I know, but like Councillor Fraser said, we're not a hotspot area. So, I mean, I think we are, if that's what you really want to say, but you're saying we're not a hotspot area. So why are we being penalized like a hotspot area? I think it has to be reconsidered and relooked at. I won't go on any further with it because, like I said, I can argue it all day, and I will disagree with you to the end of the day that I don't think the Premier and the government is looking at it very strongly in regards to how rural Ontario is being treated. I will move back to Councillor Armstrong and then Councillor McGillis.
Thank you, Mr. Warden, and to address this to Mr. McDonnell, obviously the mayor of North Dundas and myself agree on a lot of things. I do have to say I find it a little disturbing, sir, to be honest with you, that you are choosing to smile through this conversation that the warden's having with you, and just completely, you know, continue to remind us of what it's like in Peel and what it's like in other areas, and perhaps compare us to that, or tell us stories that we're all very well aware of. We weren't here to get a lesson on COVID. I think we all know how it works. We've all been living this the same as you have. With there's no disrespect there at all. You're living it at a higher level, but you're living it. But to keep lecturing us on that, or to give us anecdotes, I mean, we could all fill this night with anecdotes of things that were safe and weren't. But this is one of the more salient points. I have a lot of questions that I could have, but I won't keep everybody tonight. But the barbershops and the small businesses like that, and I think you have to remember where it is you come from, and the area that you're supposed, that we represent 70% of your electorate right here. And we're telling you, and obviously passionately arguing with you and discussing with you in a respectful manner, that we need to have this addressed. If we lose 5, 6 hairdressers, it seems like nothing to the people of Peel, and perhaps that's who you're representing. I'm not sure, but it'll mean nothing to them. But if we lose them, our economy is a very tenuous, in our small areas, a very tenuous economic situation. We lose those things. We don't have 5 people lined up. We don't have 50 people lined up like they do have in the GTA. You speak out of one side of your mouth saying that we're treated in this way, and you take umbrage with in the paper, which is, you're right, absolutely, of people like Dr. Paul and Spotty speaking about wanting to be a hotspot. You say you're not a hotspot. Stop, be community minded. Yet then we have to fall under the same auspices of the rules that you want to make for these things. I go to the dentist, and yes, it's not exactly dollars to dollars, but I go to the dentist. I'm one person in there. The masks and the gloves that they wear, there's not a reason in the world that someone that couldn't cut my hair with the exact same equipment on, and it's all safe. But yet it's not. You didn't give them a chance to fail. You took and I'm not arguing whether big box stores should be open or not. That's long gone. You made the deal with the devil, and good for you guys. So but why not allow our businesses to fail as well? Because I tell you, in my business, I travel and I deliver to a place right across the street from a Costco. You have not gone to a Costco in a long time if you are going to sit here and tell us that they are following the rules that they said they would and they could. They absolutely are not. And if it's just food products, well, somebody came out with the most delicious shoes and socks that I've ever seen in the land, because they came out with a bag as big as the size of half of my truck. So it's not being policed. You guys finally sent out and did police the areas, I believe in the greater Hamilton area. And what was the best number that came out? 60% compliance. So when we lose our economies, and we will, then A, you won't have a riding, but B, what are you going to do? We're going to need provincial money to prop this back up. So these concerns that the warden is putting forward and the Councillor Fraser is putting forward are not to be laughed at, and are not to be told us a story about Peel. We need to have your government address it. We do. You can cut me off if you want, but we need that, Mr. McDonnell. We really do. These people have suffered 3 lockdowns, and then they're only just surviving. They won't survive the next one.
And you know, we know that.
Well, you're not doing anything about it.
We are doing something about it.
You're just telling us about Peel. That's what you're telling us.
We're on the verge.
Answer the question.
We're on the verge of an ambulance showing up at the hospital. They're being told to take the patient home. That's what we're told. And I don't think you can imagine the state of affairs when that happens. Our hospitals are full, and there's no extra room. They've set up temporary field army hospitals around the province, and they're full as well. I mean, this is not fun. And you know, I go back with Frank a long way. We were on council back in the early 90s, so I know him well. And I know where he's coming from. I go to the same barber, and I feel for him, and I had good discussions with him. But you're looking at a life and death situation here that we've never had before. And you know, you talk about Peel. You know, Peel is twice as bad as we are overall. Okay, doesn't sound that bad. But Peel is over 1 million people. They have neighborhoods where 30% of the people have it. That's a hotspot. Not the whole region is not a hotspot. But you go into neighborhoods where you have apartments of a few thousand people, and there's 20-some% of the population in those buildings have it. Those are the neighborhoods that they're highlighting. Yeah, and they can't separate because they live in the same building, use the same elevators. They work in the same car plants and the same food factories that supply us with food. I mean, this is where we're at. So yeah, they're going to target 25%. Either that or they shut down the food processing plants, and then what do? And they know, the experts are saying, we've got lots of criticism over the past for giving our vaccines out on a per capita basis across the province. And I can't argue against it because it's the right thing to do if we're going to solve this problem going ahead. It's a serious problem. And I know you can go into the odd barber shop, and maybe you'll be lucky. Most of the time you will be. But we're seeing local rural areas in Morrisburg is one, where there was quite an outbreak from a couple people getting together. And, you know, I don't think there's a restaurant in this area that has a sign up that says families only. You're going to get people intermixing. That's what people do in restaurants. So those are the reasons. And you know, we just know that you can't trust people to follow the rules 100%. That's what we're seeing at parks. And, you know, when we're presented with these numbers that show that no matter what we do in 2 weeks, people are going to be turned away from the hospitals. And it's not funny. And it's happening local. I mean, I don't know too much about what's happening in Toronto because I don't get outside. I go home, it's the apartment, nobody goes anywhere up here. But when I go home, I see people out, but I also see the cases. So on a big center like Peel, we're half their level. But ours is spread across the whole riding of the whole health unit. Theirs is in particular neighborhoods, and you're talking 1 million people, same in Toronto. you're talking congestion. So yeah, we put some measures in place, but it doesn't matter if you catch it in the Walmart in Cornwall or the Walmart in Toronto. The rules are the same because the same number of people are in that one store in Cornwall versus 35 in Toronto. The same in Canadian Tire. The other stores are allowed a percentage, but we just know that if you allow personal, nails, foot care, that all those people are affected, and we have programs to help them. We're paying their, up to $20,000. Last year and this year it's $40,000 to help them get through this. We're giving them also money for their property taxes. We're covering that, copying their electricity and energy costs. But this is not business as usual. And it's not funny. And I know it's not funny, but I hear what's going on here, and maybe you haven't seen the numbers, but there are real people in our riding dying at young ages. As you listen to Dr. Paul, and we haven't got the spread amongst the young people, but it's coming. They're not in school now, but if we ignore it, we'll have this issue. We just need a few weeks. And now the golf courses are closed. But where do you draw the line? I heard gyms. Well, if you allow a gym, that's the problem. We saw what happened in the ski hill. We were criticized for that. But thousands of cases came out of that ski hill, and now it's right across the country.
Well, to suggest that we don't know the numbers, and thank you for that reiteration of your only answer, but to say that we don't know the numbers, we're living it every day as well, Mr. McDonnell. We live it every single day, and we're boots on the ground. And I'm glad that you hearken back history, because you would remember the days that you're walking around and seeing people, or that people are stopping you when you're trying to go somewhere and have this discussion. And I get the Peel thing. We don't need that lecture, and we're not smiling. None of us are smiling. There's only one person that was smiling. So again, those things. If you believe what it is you're saying, and you believe that the big box stores are policing themselves, then that's as fool's gold, because it's no different than, it doesn't address our concerns at all. It really doesn't. You can't go, you did it. Your government sent out people to inspect finally, and the numbers were abysmal, but yet they can continue to go on. So I mean, again, we'll agree to disagree, because I reject your argument in the fact that we can't be treated differently, and there isn't a possibility to allow our small economies to survive without us being the tipping point. We certainly haven't been the tipping point, and we wouldn't be the tipping point. But you cannot sit there in all good conscience and say that your category of putting box stores at 25% and they're adhering to it, and allowing Frank's barber not to cut the one person's hair, or 5 people in a day for a month would allow them to pay the rent. I've talked to people who have those small businesses and own them, and yes, you do have the programs in place. One qualified for a whopping $300 for their taxes. That made no difference to their life. And some of them are having trouble even getting answers back from your office and different offices. I mean, and I know you're inundated, but it's not. If you're the people, these people are scared. These people are hungry. These people are worried as well. So yeah, I don't want anybody to die. We know this. We're all living this every single day, but. To have our MPP just reminding us of what it's like in Peel, and saying that we can't allow our small businesses to even have an opportunity. You think you need to send some more people out to inspect those places?
It's just that you're asking about hotspots. Our numbers in SDG.
No, sorry, but I didn't ask about hotspots. You told us, and you took umbrage with Dr. Paul and Mr.
Okay.
They're not a hotspot.
Sorry, I'm going to take it as a comment.
That's been an issue. I didn't think that we should be targeting certain municipalities in our riding as a hotspot at the I guess the detriment of the areas like Winchester or Stormont. I thought that we had an area that we were basically the same, and we shouldn't be designating neighborhoods in our riding to get vaccine and excluding others. That was the argument. And I still don't believe that today. I think SDG and Prescott and Russell should be getting the vaccines spread across the riding, because I don't see any particular neighborhood worse than the others. That's not the case.
Well, with all due respect, the man on the screen beside you disagrees with you, and you've deferred to him a bunch of times today. So.
Right.
I think if we're going to be ruled or a hotspot, we're a small community. I think it should be all of SDG or all of Prescott Russell or all of Cornwall. But I'm going to move on. Thank you, Councillor Armstrong. I'm going to move to Councillor McGillis, if you would please, and then Councillor Wirt, and then Councillor Gardner. Then we'll try and wrap it up.
Thank you very much, Mr. Warden. I'll just change the subject a little bit. I want to direct this. I know that Eric is a little bored over there, so I'm going to bring him to light. Question is that, first of all, I'll make the comment that we have our different provinces of the borders of Quebec and Manitoba secured, not to bring any more people in, but there's still international flights coming in from all over the world. And, you know, you look at Brazil, we're concerned about the Brazilian flu, which is a variant, and a big concern from, the, you know, and other things and other variants that are happening. But we're still allowing people to come in, but we're closing our borders off. I was just wondering, Eric, if there's been any discussion at the federal level in terms of at least slowing down international flights, especially in countries where there's hotspots like Brazil.
Yeah, thanks, Mayor McGillis, Councillor McGillis. So yes, actually, I just did a panel tonight, and we're getting a note. We got a note today that the government is considering. India is actually, Brazil is a serious hotspot. India has got a serious outbreak as well, as an example. So I will say, agreed. I do think it is ironic that in Ontario we're at a stay-at-home order, but we'll still receive flights from India for a wide variety of reasons without restrictions in terms of why they're visiting or why they're traveling. So I certainly think that we need to look at this. I will say the complexity of this, though, just to give you an idea of the challenge it's faced. I'm not justifying it, but if you ban flights from Brazil and India, for example, coming into, I'm going to guess most would come into Pearson or Trudeau Airport in Montreal. What I found whenever the rules came in, we had snowbirds that, as opposed to taking the flight into Montreal, having to quarantine, they were flying into Syracuse and then driving across with different restrictions. So same thing of where we go and say, okay, in Brazil and India, we're not going to have direct flights. What they'll do is they'll go through Atlanta and then across as well. So there's a check and balance there that needs to happen. But to your point, I think part of this conversation, if we're going to have a series of restrictions in our province here at home, I know Jim has spoke up provincially about this, and different officials have, it needs to be the same thing with international travel as well. So we're pushing for that. We pushed for tougher border measures way back when this all started, and that certainly needs to be something on the table. And I'm glad today that they are, Dr. Tam and the government has agreed to look at this, which I certainly think at a very minimum is the right thing to do.
Okay, thank you. I will move to the next question, which will be Councillor Wirt and then Councillor Gardner.
Through you, Mr. Warden, and this is just a comment. A year ago, if we'd have convened this meeting, I think that our biggest challenge would have been the unknown, because we were entering into something that none of us have ever experienced. But tonight in this process, I think that our takeaway from this meeting should be the fact that we have light at the end of the tunnel. And that's the most important message that we can convey to our citizens. And Dr. Paul, my only comment to you is that the 80% figure, once we have the vaccines in this country that are going to allow us to reach that level, which I think is the most sought after goal of all of us, I would compel you to make that public so that people do understand that we're coming out of this. And I think it'll go a long way to addressing Jamie's comments about, you know, the unlawful protest and the issues with the parks. And even the fact that people are neglecting the system to try and pick where they're going to get their vaccines. If we understand going forward that we're going to get this behind us, I think there's going to be tremendous upside to that story. So that would be my my comment, and I'd like to thank everybody for putting their time in on this tonight, especially Jim and Eric and Dr. Paul. Thank you.
Okay, thank you, Councillor Wirt. I'll move to Councillor Gardner, then Councillor Warden.
Thanks, Warden. Just a quick question for Dr. Paul. I'm just worried that we might have given out some dangerous information. So I just kind of want your clarification on the AstraZeneca vaccine. You know, the idea, somebody had said their doctor told them that any vaccine with this is better than getting COVID. So just if you can speak to that. And then a quick question about our young essential workers, like a 25-year-old that works in the stores and goes from store to store, are they eligible for the vaccine now?
First, thank you for that first question and the second one. AstraZeneca vaccine has been administered in Britain to about 25 million people. They had a very low incidence of this clots. Just to give you context, 1 in 250,000 was a very low number. A woman that take the pill, the estrogen pill, it's 1 in 1,000 clots. If you get COVID, you have a 1 in 10 chance of getting clots. For some reason, COVID clots our blood. That's one of the problems that we get. That's why people can get some heart attacks and even strokes with it. And if you're hospitalized, it's a 1 in 5. So there's a huge, you're better off taking a chance on the vaccine than getting COVID. So,
thank you, because I'd hate for people to be, the people that are watching this to get the impression that whether it's a province or whatever have, stated that it's unsafe. And I was comfortable with your numbers, and the women know that, out and about. So,
sure.
Okay.
No, so that's, again, that's a very important clarification. Again, people are, I know that people are shopping around, but get whatever vaccine can be put in your arms, get it done.
Thank you.
Bottom line. Second,
And then our young retail workers that have been deemed essential.
Well, let me tell you, one of the things that we're doing, and I've got sort of the thing in front of me here right now. Phase 2 was supposed to have younger individuals, younger than 70, 60 and under. And then it was supposed to include the people that can't work at home. And there were 2 groups of those. The first one was first responders, teachers, migrant workers, and so on that are very high risk. And then we would go very quickly to the second one, which would include retail. So they would be in the second group of phase 2. Our initial thought was that we would be there now, because that's what we were told. But because of vaccine supply, they told us just to go 60 plus and wait another couple of weeks. So my suspicion is that we're going to start those essential group 1 workers, which is, like I said, essential first responders that we haven't gotten phase 1, teachers, daycare, those type of things. And then very quickly move into phase 2, which will be retail, grocery stores, and then there's a whole list of there. That's why some people are saying, well, maybe just do it by age, do it, 50, 40, 30, 20, and then get everybody done. But we do believe that we're probably going to go down to like 50 shortly, 50 plus, because that's who we're seeing that's dying in the hospital now. And then as soon as we go there, then we're going to say, okay, then we go to these essential workers. So that's when they'll come. So that's them, that's city workers, wastage, like there's a whole list. There's a very long list.
Yeah, I mean, I ask only because my 25-year-old son, before he returns to school in the fall, has been a merchandiser. So he's going around to multiple grocery stores, Walmarts and stuff like that. And for the salary he is getting to keep he lives with us, to keep the rest of our family safe for over a year and a half, I would, definitely hope that they would be in line for the vaccine, because they're in high risk contact.
They are. I would have thought that we have already been very closer to that. And it's because of the vaccine, because of the pivot. I was surprised the ministry told us start doing 60 plus instead of going to the essential workers.
Yeah.
In a sense, it's probably a more risk-based decision, because what we're seeing now is more of the 50, 60 dying. That's what we're seeing.
Well, I hate to admit this, but I will be 50 soon, and it's putting me at risk. So if the MPP can take note that some of that needs to also match the thing, because it's important. So thank you.
Hey, thank you, Councilor Gardner. I'm going to take the last question. Oh, Jim, did you have a comment to that? Sorry.
Yeah, they've been identified, and Dr. Paul has that chart up on his website that shows the phases, and within phase 2, there's essentially a little bit of the age, but it's all the essential groups. Anybody that can't work from home, basically. It's a big group.
Okay, thank you. I'm going to take the last question from Councilor Worden, and then we're going to move off to final comments from our invited guests. So Councilor Worden.
Thank you, Mr. Warden. This question's for MPP McDonnell. I've had a lot of parents contact me. I have a school-age child, and as you know, the children are being schooled from home. Has the government decided, will they announce sooner or later if the kids will be going back at all this year, or is it something that's going to be put off right till September? I'm getting a lot of calls from parents that are concerned. The homeschooling is at least for my child, that she struggles with it. So do you know if is there any update for that maybe parents could hope, is there anything?
Well, we know, especially elementary, it's just, they have to get back to class. And, we've
You
always
talk closer to your mic, Jim.
Oh, yeah, we made the decision up front. Is that okay now?
Yeah, I think so.
That schools would be, last to close, first to open. Now, saying that, if the lockdown is to occur over 6 weeks, we're 2 weeks through it, the numbers are starting to flatten out. So if they start to come down, and we have to get the community numbers down. They don't go into the school, because once one gets into school, you isolate them 2, 3, but when you get multiple classrooms, it gets very difficult. So that's really what we could. So the hope is that certainly when the lockdown ends at 6 weeks, we're hoping that with the vaccines, like Dr. Paul's given some good news that will happen at the end of May, that we're looking at as a possibility. And by that time, hopefully we'll have the teachers vaccinated as well, because that's a major concern. They're dealing with a room of 15 to 20 children. And we really need to get them vaccinated as soon as we get enough supply. So I think that's all going to happen around the end of the month. So hopefully that's true when we get the vaccine. There is a priority to get them back, even if it's only for a couple of weeks.
Okay, thank you. I'll take a subsequent, Councillor Warden, and then we'll
I
move
think
on.
Dr. Paul wanted to chime in.
Sorry, Dr. Paul.
Yes, so thank you, Warden. Yes, as a matter of fact, I'm on the education table provincially, and today we discussed that. And what we're trying to do is we're trying to determine at what level we can be safely reopening the schools. So I do suspect they will open before the end of the year. But what we're doing now is we're taking it week by week and looking at again the levels. We've got to be lower than red, obviously, and more of the orange zone, because that's where we have comfort. We can control the cases. And so, yeah, it doesn't mean, and it may be even before the lockdown is over.
Right.
But that depends on the number of cases. So that's something that we're actively working on. So again, the other factor would be percentage of people vaccinated and the cases as well. So it doesn't, and again, they're the last to close, the first to open.
Perfect. That's great news, Dr. Paul. Another question that I had was, it may sound silly, but can you be waving a flag that Eastern Ontario will take any extra vaccines, whatever? I think people that are shopping around, I think maybe are missing an opportunity to be a little bit safer. So I don't know if there's a way that you could, Jim, you as well, if you can wave the flag saying we'll take whatever you got in little old Eastern Ontario here, because we need to get our businesses open.
Well, the good news, I think, as we mentioned, if you look at the per capita numbers, we're in the top half, which is good news. But it's a big province. There's a lot of people get vaccinated. There's a lot of people choosing not to. But it's a challenge, And as I said, even I go back, and not that I use Peel, but there are Peel as an example. As bad as it is, they're the third worst in the province for vaccines being administered. People don't want it. So there are challenges right across the province. We have people in our riding that don't want to take it. They're taking a chance, and that's fine. But if we get up to around 80%, I think it's Dr. Paul would probably check the numbers, and those are pretty good numbers, and we can start to return to normal.
Yeah, I can. Mayor Warden, it was I think Mayor Wirt that said something that struck a tone to me. First of all, I do on my biweekly media briefings, I always say that the light at the end of the tunnel is that it's different this time around, that we will be coming out of this with a certain proportion of the vaccine being given. And on another table that I sit, which is the public health measures table, we are on now actually looking at an exit strategy where we're, for the first time ever, not only looking at number of cases, number of hospitalizations, all those other things, case rates, we're actually looking at vaccine rates. So as we approach a certain, like a 50% vaccine rate, then we can open up certain things. As we go 75%, we can open up more things. And those are going into May and June and July. So I do see that the light is at the end of the tunnel, and more vaccine, the quicker we do it. So I actually gave this pep talk to my staff this morning, because I told them, I said, listen, this is what we're doing. For the first time ever, the more vaccines we put in the arm is going to make it sooner that we start opening other restrictions and allowing our businesses to operate and people go back to normal. And now it's not going to be a fully normal year, but as we get into the month of July, August, and September, it'll be more normal. More people will be able to gather, and because we're a bit more behind in the States. In the States, they're taking masks off because they have the 2 doses. But once we get even a certain amount of people getting first dose, we'll be able to have more maneuverability. So I think there is that light at the end of the tunnel. So I wanted to end it up on a positive note, and I was happy that Mayor Wirt said that, because to me, that's the bottom line. We need to know that we're working there, and it's only a matter of, like I said, a shorter period of time. And yes, it's the 3rd time round, but it's the first time we're going out with vaccinated population.
Okay, thank you. I have 2 final questions that I'm going to ask, because I get a lot of these questions in regards to people are asking, is it fair to say that they can start booking vacations in September, October, November, or is that out of the question at this point?
Depends where they want to go. Depends if they've been vaccinated or not. If they want to go to the States, probably better bet in the States and other countries, because they're vaccinated and they're going to be eager to get tourists. And if you're vaccinated, you'll be able to go. But it's hard. It's not going to be business as usual. So they'll have to be very selective.
I guess to go along with that question, are they going to have to be vaccinated twice before they can travel, or is one going to be satisfactory?
Twice.
So if they get it in July, that means, or August or September, that means they're not traveling at least till next year.
Exactly. But I'm optimistic that we'll be able to vaccinate people before 4 months, because I do see the numbers coming in, and I think we'll be able to do it in a quicker time frame. The other thing I want to say is that don't be surprised that in the fall we go into the schools and vaccinate 12-year-olds and above.
Okay. And the other part question that I get asked all the time is, they're asking if somebody could stand up and come forward and tell the people, honestly, in regards to where we are today in respect to numbers and so on, how long we're going to be in this before we're completely out of it based on our numbers that we have today. And I don't know if anybody can answer that question. Are we going into spring of 2022, or are we going to be completed and have a normal Christmas by December?
I'm thinking we're going to have a very close to normal Christmas this year. That's what I'm thinking. And okay. I'm thinking that we're going to have a much more normal September than we did last year. Okay. Again, I'm judging on the numbers. I'm judging on if all goes well, but
if the information you have today, and that's all we can go on.
Yeah.
Okay. All right. Thanks very much, gentlemen. I'll go Francis, Councillor Landry, and then I'm going to close up with Mr. Duncan and then Mr. McDonnell and Dr. Paul.
Thank you very much, Mr. Warden. So it's a quick question in regards to concentrating on the first dose. We're going in with the second. Are we given the same injection of whether it's the Pfizer, and is there an issue if we were to be crossed, or to make sure that we're getting the same as what the first dose was?
For now, no. For now, we know what dose you have. Our system knows what dose you got first, and we know what dose you're going to get. So we don't want to interchange the vaccines. If you got Moderna, you're going to get Moderna. If you got Pfizer, you're going to get Pfizer. If you got Astra, you're going to get Astra. Now, the other thing, the good news is that we might get Johnson & Johnson, which is 1 dose, and it'll solve a lot of our problems. So we might expedite things if we get it quicker.
Thank you.
Okay, thanks very much, gentlemen, for your comments this evening, and thanks to all the questions from our members of County Council. I will reverse in regards to how we're going to close this. We're coming on 2 hours, so if we can try and wrap this up as quick as possible. I will give our MP, Mr. Duncan, a few more minutes. More than the other 2 gentlemen, because he hasn't had an opportunity to speak very much. But I'm going to ask you a question, and maybe you can answer in your comments. What is your government doing to force the Liberal Parliament or Liberal government in regards to getting more vaccines to our area and across the province and across this country? Maybe you can add that in your comments and your closing remarks.
Certainly. Thank you, Mr. Warden, and thanks for the invite to be here tonight. I have to say, honestly, I do miss sitting at the County Council table. My hand almost went up to vote in favor of the agenda earlier. It's like maybe an old habit after being there for 8 years. And I say that I miss this because my comments I get frustrated in this new job. I love it. Don't get me wrong. I'm honored and I do love it, but I certainly miss my municipal days as a mayor, being able to pick up the phone, speak to the CAO or council, and being able to see movement on some things a lot quicker. I always complained that I thought how slow things move municipally until I came to Ottawa, and have a new appreciation for all the work that you do. But in all seriousness, a couple of points that I want to make. One, from the customer service level, I just want to remind people, my staff are working from home. We have one person in the office a day. We're going through, we are doing our best to answer the phones live, but getting back to people on the same day. If it's EI or CERB, please send people our way. And the same thing with the wage subsidy and the business accounts. We're still helping quite a few people that are caught in a rut or in some gaps in the program. And I know Jim has been working quite a bit with many people on the Ontario Small Business Grant. Get them to him. And I've seen even my list cross off of people that have reached out on that. On the vaccine front, to your point, Mr. Warden, you know my nature is not to play the blame game, but I don't think I need to state the obvious that I wish the situation was better, and I wish we had more vaccines back in January, February, and into today. I can't litigate that or change that tonight, and I won't. But when you ask about what we're trying to do, I'll note some creativity that we're starting to get and see at a provincial level. If you saw in the news in the last couple of days, Brian Pallister, Premier of Manitoba, have been reaching out to different governors on the other side of the border in the States. And they've actually been able to secure a deal where 4,000 truck drivers who are going back and forth between Canada and the US, they're all 4,000 are going to receive both doses of vaccines in the next 6 weeks. I think that's a positive step, and I think there's some creativity there of what we can do and how we can work out. Domestic production is something that, again, is not going to be solved overnight, and there's going to be a lot of questions and what we do different when this gets all said and done. And I think there is unanimous support at a federal and provincial level to have a public inquiry of sorts. And I don't mean that in a facetious negative term, but there's a lot of lessons learned that we can be ready for the next public health emergency that our country faces. I'm going to wrap up tonight. What can we do? I'm frustrated where I'm at. We're asking questions every day. We're trying to get information, trying to come up with creative ways to get more vaccines into Canada. But I want to allude to what Mayor Wirt said earlier about people getting light at the end of the tunnel. I know Dr. Paul alluded to this. This is absolutely key. I think when you look at the US, in the UK, you've heard me speak about that. The CDC, Dr. Fauci in the US, the United Kingdom and their National Health Service, they've got benchmarks, to your point, Mayor Wirt, about when they get a certain percentage vaccinated, when cases at a certain level, hospitalizations, here's the tier that opens, and here's what we're doing. And I start to think that actually helps for a couple of reasons. If we at a federal, national level can say, when you've received both vaccines, you can travel, you can do X, you can do, and we get out of this. I actually think not only is that from a mental health perspective and skeptics of seeing the light at the end of the tunnel, I think that's huge. But also on the other hand, I think it's going to help contribute to reducing vaccine hesitancy. And I see that as our role as individuals, and what we can do is encouraging people to get the vaccine. The more people that get vaccinated, the sooner we get opened up and the better off we're going to be. So my pitch to that I'm working in Ottawa is to get that plan for inspiration, to motivate people to get vaccinated that are hesitant. But I'll just say for ourselves as local leaders, I don't see you all anymore. I see you on Facebook and the work that you're doing. I encourage you in your municipal, municipalities and social media, like you've been doing, share the vaccine clinics. Whenever you get your appointment book, let your constituents know. When you get your vaccine, take a picture. When your staff or other leaders in your municipality do, promote that. When you're out in the community, I always ask people, are you going to get vaccinated? I'm very impressed by the number that are going to. They're waiting, but somebody that may be skeptical, I make the pitch to say, look, I know you're frustrated. Here's some information on the vaccines. Here's why we should do it. And I think we all have a role in encouraging people that may be undecided or not see the seriousness of it. Those are some small things that collectively, us as leaders, I think can push us to the finish line even faster. So with that, I encourage you to keep in touch with Adrian and myself in my office. We try to keep accessible. There's anything we can do. And lights at the end of the tunnel. Some days we're 2 steps forward, some days we're 1 step back, but we are getting there. And I thank you all, and particularly Dr. Paul and everybody working on the front lines to get us past and through this. Thanks.
Okay, thank you for your comments, MP Duncan. I will move to our MPP, Mr. McDonnell, for final comments if he has any. Mr. McDonnell?
Yeah, I guess I'm a little more optimistic. I'm hoping that we hear that 80% number by the end of May. I think that's, I'm hoping for that, and I think that that's a real possibility. Especially we have the US that's getting to the point where they're having a hard time getting rid of the last vaccines, so those should become available. And I think, you know, as I say, some of the premiers and the prime minister have been dealing with the politicians in the states, and we hope to see that. So this is actually good news. So I'm hoping for a much better summer. I myself too have been lobbying for this, basically kind of a vaccine passport, so that you can go into a small business if you're vaccinated. I think there has to be some reward put out there. And some, you know, if the business restaurant wants to say, look, open to vaccinated people only, if that can get them open earlier, I think that we have to start looking at that. I know that we're looking for a federal type regulation, so I'm glad that Eric has brought that up, and I think that's a good point. So, but I think the message is clear. Over the next, you know, 4 to 5 weeks, we're in a crunch situation. You know, where we have the vaccines coming in from one side, we still have our hospitals overwhelmed. Just, you know, if people could, you know, stay home, stay separated, go out when it's only important. And remember that there are a lot of people out there that are still working and looking after our livelihood by working. So let's, you know, let's help them out by making sure we're protecting them by staying out of the mix if possible. So it is a tense, and you see some of the voices raised today, and that's because it's an emotional issue. And everybody knows somebody that's hurting. And I certainly know many of them. And I hear from them. Our office, though, we have a SWAT team that's, as Vic Fideli calls it, that's looking after the small business grants. If you have a problem, there's no question, you know, we've received, you know, 300,000 or 400,000 applications. So a lot of it's done by computer. If you kicked out, we have looked after each individual case, and we've had good luck with that. I talked to them last night again. They said just beware. The number of cases, we have a good few hundred people on it, but it's going to take a couple of weeks before they get after the ones coming in today. So, so if you run into somebody that has a problem, let us know. We're trying to help as many as we can. It is an unprecedented time. You know, as our neighbors are getting vaccinated, hopefully that frees more up than we know about. But even for what we know about coming in or anticipating, we're looking at 80% by the end of, you know, we're looking at 4 or 5 weeks here. And that's really good news. So tack on 2 more weeks. And that's, you know, those people are receiving the protection that will allow us to start lifting these regulations and hopefully get into a fairly normal summer, which is I think everybody's dreaming about. So thank you. And so if anybody has any questions, you know, get a hold of the office. We're glad to discuss these things and to bring things back to the caucus. We've been fighting over our numbers. The fight's not from a point of strength because, you know, we're probably better off than half the province. So, and that's more luck than anything else, but that's the fact. We got to get people vaccinated, and Dr. Paul has done a great job. He's doing 1,000 a day, but if he gets the supplies, he could easily do 1,500 per clinic. And those are big numbers. And even at the rate he's going, we're looking at the end of May. So the light's at the end of the tunnel. I think it's good news going forward. A couple of tough weeks, but if we hunker down, the rest of it should be good. And we want to get the numbers down, get kids back to school, and get back to normal. I think that's the message we want to leave here. We're only talking a few more weeks.
Okay, thank you very much, Mr. McDonnell, for your final comments. I will go to Dr. Paul, if you would, please.
Yeah, I'm just going to do it very short and sweet. I'm just going to show you, this is the light at the end of the tunnel. This is actually the map to get out of this based on what Eric had said. Yesterday, we had a presentation from PHAC, the Public Health Agency of Canada. There's modeling, and we have different thresholds, 55% coverage, 70% coverage numbers. And so this is the way out. And I'm holding it in my hands. So we're looking at it right now. It's a confidential document, but it's not confidential that what's on it. It essentially says approach of exiting the closures, and we have thresholds. And we're looking at thresholds, for example, at the end of, by Victoria Day, where we're at, what can we open? By July, what can we open? And now, for the first time, we have it. So this is exactly what Eric was talking about. And this is the inspiration, again, this is the inspiration that our staff will have and our community will have to keep going, because for it shows us the way out. We've got it on a map here now. It's theoretical, it's on paper, but it's going to work itself out. We're going to look at hospital admissions, weekly rates, and for the first time, number of people and percentage of the people vaccinated. And we even have, with the Public Health Agency of Canada, let's say we have so many variants and how's the vaccine working against the variant? We have different formulas for different scenarios. So they're being worked at as we speak. And that's the first time I can speak publicly and say that we're looking at an actual real exit strategy. And I want to thank all of SDG, all our municipal partners for the tremendous collaboration. As Jim said, we're on track to vaccinating as many people who want it, between now and the end of May. And if we continue doing that, and I can also tell you that there's going to be a regional approach to opening. So even if Toronto and Peel are behind us, we will open earlier. That's the type of thing we're going to try to do. So the quicker we get it done, the quicker we're going to have a better summer.
All right, thanks very much. On behalf of the members of council and staff that are with us tonight, I want to thank the three gentlemen for coming out. It's certainly, I know in regards to your schedules, the three of you have very busy schedules, and we appreciate the little over the 2 hours that you spent with us this evening to try and answer the questions that we had and the comments that were received. I know sometimes it's frustrating from our side in regards to trying to answer to our residents in regards that we don't have a lot of the answers sometimes, but in the future, if there's anything we can do as mayors, deputy mayors, and councils, please don't hesitate to ask to try and help to support you in regards to trying to get out of this pandemic as fast as we possibly can, because that's what the people are looking for. As we all know, people are getting tired and frustrated. So the more information, positive information that they can receive on a weekly basis, I think is what's going to help our residents feel more comfortable and maybe even try and follow the rules a little bit more than they're following today. So again, thanks very much to all of you, and to members of council, thanks for being here this evening. And to you three gentlemen, thanks again for joining us. Have a good night, everyone.
Through you, Mr. Warden, do we have an adjournment resolution?
Oh, I'm sorry. Yeah. I'll ask the clerk to read the motion for adjournment, please.
It's moved by Councillor Armstrong, seconded by Councillor Williams, that council adjourn to the call of the chair.
Thank you, Madam Clerk. All in favor of the motion? The motion is carried. Thank you.